Hello, how are you? Welcome to this session on health planning at the primary health facility levels. My name is Winnie Barawa. If you're new, this is a channel where we share lectures and knowledge in regards to health and any related cause. So the primary health unit level most of the time refers to health facilities that could be including both government, faith-based organization, and the non-governmental organizations. So with the service delivery systems, most service delivery systems starts with the community level where we work with the community health workers or the community health extension workers. And now when we progress from the community level, we move to the second level, which is the primary health level. Here we work with health facilities that are included to be a bit more specialized. They have more equipment or more services that can be provided to the community. But now when it comes to decision making and developing the annual work plans, what are the primary health facilities supposed to do? So the developmental process here will copy a bit of what happens at the community unit level. However, the composition of participants is a bit different. So you can have facility in charge who will later on select 2 to 5 people to join him or her in the team. So the participation of this team is made of the facility in charge, who can be a medical officer, a clinician, or a nurse officer, depending on the facility level that you are composed at. And then the planning team should then choose any other person to join this team. And this could be either health records officer, who will then assist in compiling service delivery data. You can also, elect in an administrator or a hospital accountant whose key responsibility will be helping in compiling administration data, could be in terms of cost and budget or any other inputs that will be important for the development of the annual plan. For this team will now form what we are calling the Health Facility Committee. And this Health Facility Committee will then be working closely with the County Health Management team to help in generating the more detailed
follow to
annual
develop
plan
the
that will be for the
annual
county level?
work plan?
So the first step is the County Health Management team will meet the in charges in their various facilities to discuss the various demographics. And in these catchment areas, it can follow different levels based on the leadership delivery again. And in this case, we can discuss it at the sub-county level, that is for the sub-county health facilities. And you can discuss it at the county level where we talk about the county referral facilities. And you apply this to all the facilities, that is both governmental, local, faith-based, and even the non-governmental organizations. So in this facility, they will discuss the inputs of demographics, health status, health achievement, health challenges, and so on. And then together, they will now come and develop the baseline and the targets that they wish to achieve for each facility at the various levels. So the spearheading team for the primary health facility annual planning is the County Health Management Team, what you're commonly calling the CHMT. So CHMT stands for County Health Management Team. It's a bigger team that is made of more specialized units from public health, nursing officers, medical officers, nutritionists, and all these managers that can help in representing the different key indicators in the county. And so once they come together with the facilities after picking the data that has been aggregated from the community level, then they now generate the baseline and the targets for each facility, looking at what are the gaps they identified and how can they reduce or eliminate the limitations in these particular facilities or catchments. Second step, after getting the data from the facilities, they sit down and provide information on available financing. Now, remember under financing in our previous lectures, under investment planning, we say that financing could either be available financing or we talk about the probable financing. So the available financing is what is the government providing in terms of resources to help in achieving the annual work plans. So if they're available, then they can be given the required amount that they will spend for that particular year, and then they put that into consideration, ensuring that they cover each and every service that they want to focus. So in looking at the allocation of these resources, they will therefore be putting more priority to services that are very key and important, as opposed to haphazard allocation of this budget without consideration of the funds. So the facility, after being given the available information on finances, they then progress in putting their own plan into process or into developing the final plan for that facility. And with that, you need to understand that this process of working with the primary health facility to generate the annual work plan is supposed to take also within 7 to 10 days, and it occurs concurrently with the development of the community plans. So remember, we have this level 1 of community planning or the community annual work plan planning. It happens literally like at the same time with the facility. Sometimes they do it together, like they go into a common meeting and they all consolidate their work so that they don't like have separate meetings. But you're told as the community is ongoing with their plans, the facility also needs to be consolidating and working hand in hand to get this information at the same time. So that was it on the primary healthcare level, where we looked at how the health facilities, be it governmental, non-governmental, or faith-based, work together with the county health management team to generate the annual work plans that will later on be consolidated and be taken to the county level, where they will generate the county annual plans that will later on be consolidated to the national health sector annual plans that will guide the whole country around the 47 counties to ensure that they meet the needs and the indicators of the population requirements. Thank you very much, and remember to subscribe, share, comment, and if you like this channel, kindly give us a thumbs up or a like. So thank you so much, and see you in our next session.